All right, we are going to be demonstrating how to give an IV push medication through an existing continuous infusion. So the first thing we would want to do is to check Davis to make sure that our medication is compatible with the fluid that we currently have running. Again, we have the ceftriaxone, 20 mLs, 2 grams, and that is to be given over 1 to 4 minutes. So again, I'm going to go in the middle and give that over 2 minutes, which would be about 5 mLs every 30 seconds or 2.5 over every 15. We checked Davis, so we're compatible then with the normal saline, so we're good to go ahead and give this through the port here. We have our flushes, alcohol wipes, and everything ready to go. Again, introduce ourselves. We're going to check for allergies, check the MAR, check name and date of birth. Everything is good to go. So then we are going to hand sanitize. And put on our gloves. We're going to take a look at that site again, make sure that everything looks good, no tenderness, no redness, no swelling. Checking for phlebitis, but everything looks pretty good here. So then we're going to go ahead and get started. The clamp is undone, obviously, because our medication is running through. So then we're going to find that port that is going to be closest to the patient side, this one here, and grab our alcohol wipe. And we are going to alcohol that off for 15 seconds. All right, and let that dry. And then we're going to grab our medication. Make sure we have no air bubbles. That is good to go. So we're going to connect that to the port. And we are going to be using the pinch push method here. So we take and we pinch right above the port as we push the medication through, and then unpinch, allowing for that IV fluid to run through in between. So then we're going to go ahead and pinch, and then we're going to start pushing that medication through, watching the time. And checking with the patient in between, making sure that they're comfortable and we're good to go. We're almost done here, Mr. Smith. and we got all the medication in there, so we're going to disconnect this medication from the port. Take an alcohol wipe. We're going to wipe that port off for 15 seconds. And then we are going to grab our flush. We're going to connect that flush. And then we are going to go ahead and just flush this with 2 mLs of normal saline. Just to make sure all that medication gets through like it should. Get rid of that as it's one-time use. Then we're going to take an alcohol wipe. And we're going to alcohol that port off again for another 15 seconds. All right, and then they are good to go. Had the medication not been compatible, then what we would do would be pause or stop the pump, and then again find the port and clamp it down, pause it, clamp it. Again, find the port closest to your patient. And then the same, we're going to alcohol that off, and we're going to do the same push pause technique with the pinching, getting all that medication in. Do that the same way, except for the only difference is that at the end we would also want to flush this port with the entire syringe, the entire 10 mLs of the flush, to ensure that all that medication gets through there, because you don't want to have any reactions, and you're going to push that at the same rate as you did your medication. And then again, removing the syringe, wiping your port, and then restarting, unclamping and restarting your IV. And then remove our gloves, hand sanitize, and make sure all of our things are cleaned up. Thank you, Mr. Smith.